This is something you 100% didn't know. The most important insights are revealed step by step. That's why only by watching this video to the end will you get a complete and structured understanding. What if I told you that one of the most common surgical procedures in the world is performed on a body part that many people don't actually need? Can you guess what I'm talking about? Every year, millions of perfectly healthy teeth are removed, not because they're damaged, but because they might cause problems in the future. Some people never even notice them. For others, they quietly undo years of dental work. So how do we deal with this? Why do some people go their entire lives without ever noticing their wisdom teeth, while others experience pain, infections, or even nerve damage from teeth that never fully come in? The answer isn't obvious. It's not listed among the symptoms, and it's rarely visible in the mirror. That's why most people have never heard of what I'm about to tell you. To really understand it, we have to look deeper, not only at the jaw, but back into the past. Wisdom teeth usually appear quietly, almost imperceptibly, at a time in our lives when we think our bodies are fully formed. They typically emerge between the ages of 18 and 25. But here's the problem. Many of them never erupt into the mouth at all. They're blocked, misaligned, or compressed deep within the jaw, simply because there isn't enough space for them to grow naturally. And this lack of space is not an accident. To understand why this happens so often, we need to look beyond modern dentistry and back thousands of years into human evolution. From an evolutionary perspective, wisdom teeth once served an important purpose. Early humans had wider, longer, and much more powerful jaws than we do today. Their diet consisted of raw plants, tough roots, and uncooked meat. Teeth wore down quickly, so extra molars were essential tools for survival. In that environment, wisdom teeth weren't a problem. They were an advantage. Biological insurance in a world without dentistry. But over thousands of years, everything changed. As humans learned to cook and process food, our jaws gradually became smaller, but our teeth never got the message. That's why many modern humans inherit jaws that are simply too small for a full set of 32 teeth. Around 35 to 40% of people are born without one or all of their wisdom teeth. And this is not a disorder, it's evolution. Being born without wisdom teeth is not a defect. It's a natural variation, and in many ways, an adaptation to the modern human jaw. Here's the part most people are never told. Two people can have the same wisdom teeth and completely different outcomes. One never feels a thing. The other ends up in surgery. The difference comes down to factors you can't see, but can predict. Wisdom teeth themselves are not the villains. When they erupt normally and align correctly, they can be harmless. The problem begins when space is limited. In those cases, wisdom teeth press against neighboring teeth. They cause pain, swelling, bleeding gums, and chronic bad breath. They crowd the teeth, disrupt alignment, and can lead to decay, infections, and cysts that damage the surrounding bone. Sometimes, only part of a wisdom tooth breaks through the gum. The rest remains hidden beneath tissue and bone. According to the World Health Organization's global recommendations for oral health, such conditions significantly increase the risk of gum disease and infections if not controlled and treated properly. A perfect environment for bacteria. Food and bacteria get trapped where toothbrushes and floss can't reach. People may feel fine for months, even years, while infection quietly develops beneath the surface. In some cases, wisdom teeth affect facial nerves. Their roots can sit dangerously close to major nerves of the face. Pressure or inflammation may cause numbness in the lips, chin, or tongue. And in rare cases, long-term changes in sensation. The risk increases when a wisdom tooth grows at an angle. Instead of growing straight, it tilts forward and presses against the neighboring molar. That pressure builds silently. It may not hurt at first, but it slowly damages enamel and bone. By the time symptoms appear, both teeth may already be compromised. Sometimes, both are lost. That's why I ask my patients one simple question: why risk 2 teeth when you can save one important tooth? When symptoms appear, proper diagnosis is essential. A panoramic X-ray reveals the overall picture, and modern 3D imaging allows precise treatment planning. A 3D scan isn't just an image, it's a map. It shows exact tooth position, root shape, and nerve proximity, helping prevent complications and ensure safety. The procedure itself is usually straightforward. Local anesthesia completely numbs the area. Patients feel pressure but no pain. The course and ease of the procedure largely depend on the surgeon's experience and the specific position of the tooth. In most cases, the patient goes home the same day and quickly returns to their normal routine. Sick leave is rarely issued, usually only after a complicated extraction or if complications arise. After tooth extraction, there are 2 possible healing options. Healing with a blood clot. A blood clot forms in the socket, protecting the wound and supporting natural healing. The area heals on its own, without sutures. Suturing the wound. The surgeon places sutures to better stabilize the tissues and ensure more controlled healing. This option is more commonly used after complex extractions. After healing. In the first case, if non-resorbable sutures were used, they need to be removed by a dentist. In the second case, resorbable sutures are used and do not require removal as they dissolve on their own. Even after orthodontic treatment, late erupting wisdom teeth can shift other teeth. That's why they're often removed preventively. Removal of wisdom tooth is often recommended when it has no adjacent supporting tooth. If a wisdom tooth has no antagonist, it does not participate in chewing and over time may over-erupt, traumatize the oral mucosa, be difficult to clean, leading to inflammation. If there is also no adjacent tooth, is harder to keep clean, is more prone to caries, has no functional value in the bite. In such cases, the wisdom tooth is considered non-functional and preventive removal is often advised to avoid future complications. The final decision is always made individually. Modern dentistry makes this process safe and efficient. But understanding why wisdom teeth cause problems through biology, evolution, and clinical evidence helps us make better decisions. Because these teeth are ancient remnants of our past, living inside a very modern mouth. So here's the real question. Do you have wisdom teeth? And what has your experience been? Did they never bother you? Or did they turn into a real problem? Share your story in the comments.